This week's materials are centered around the central nervous system. This probably being one of the largest units we have, or the most amount of medications that we have in any one given unit. So we actually have 5 parts of lecture to this. Take your time, space them out. Don't listen to them one after another. If it's helpful, read the section in the book, look over your notes, listen to the lecture, fill in your notes, and then take a break, and then go to the next grouping. Because I said there is a lot of information that comes along with the central nervous system. As we're dealing with medications that affect the brain and the spinal cord, there are a lot of medications that have an effect on our brains. Our objectives for this unit are that you should be able to describe the stages of the sleep cycle. You should be able to describe the mechanism of action, clinical indications, and adverse effects of the barbiturates. You should be able to describe the mechanism of action, clinical indication, and adverse effects of the benzodiazepines. So this group of medications is called the sedative and hypnotics. As a result, they directly affect the sleep cycle. So we have to spend a little bit of time making sure that everybody understands what goes on with our sleep cycle. The normal sleep cycle is really divided into 2 different states: the non-rapid eye movement state and the rapid eye movement state. Many of us are familiar with REM sleep, and REM sleep is that point where you are actively dreaming, and if you're watching someone who's in this stage of sleep, you can actually see kind of their eyes moving around underneath their eyelids, hence the name of rapid eye movement sleep. But the bulk of our sleep is made up of REM sleep. And non-rapid eye movement sleep can be divided into 4 different stages. I'm going to give it a few extras. And kind of get a feel for what those different stages are about here. Stage 1. In stage 1, the person is very aware of their surroundings, but they're really relaxed. Eyes may be closed or eyes may be open. The alpha waves are predominant in the brain if you're looking at the EEG. And it normally lasts a few minutes, and it's really only about 4 to 5% of the total sleep time. This is the point where you're sitting in class and your eyes are open, but you are not comprehending anything that the teacher is saying. Or you may be in front of the TV doing the same thing. The eyes are awake or just kind of droopy, but you're really not paying attention to what's going on. In stage 2 non-REM sleep, the eyes are definitely closed, and you're unaware of your surroundings, but you can be very easily awakened. This is that point where your head bobs down, and then a commercial comes on, and boop, you pop your head back up again. That's that stage 2 of non-REM sleep. And it really takes up about 50% of your total sleep time. So about 50% of the time you're asleep, you're in that state where you can easily be awakened. Stage 3 and 4 non-REM stages, we kind of lump them together. There's just a slight difference between one to the other. But this is the slow wave sleep. On an EEG, the waves are very slow and rhythmic. They are deeper stages of sleep, and this is where physical rest and restoration happens. So this is where a lot of the healing in the body goes on. It takes up about 20 to 25% of your total sleep time. So let's start looking at the medications that interact with these sleep cycles. MOA, as we talked before, is mechanism of action. The mechanism of action of sedative-hypnotic drugs is that they work with the various neurotransmitters. Your brain is dependent upon neurotransmitter, and each neurotransmitter is released from a specific nerve ending and functions to either stimulate or inhibit the neuron activity in the brain. One of the most important inhibitory neurotransmitters is called gamma aminobutyric acid. We call it GABA. It's the easiest. It's much easier than trying to remember that long name. The function of the neurons is dependent also upon various ions, such as sodium and potassium and chloride. So each of these ions is going to move in and out of the cells through specific channels. Well, what happens is when the gamma aminobutyric acid, or GABA, binds to its receptor, it blocks some of these channels, and it reduces the generation of those action potentials in the cells, so the cells are not able to react, and therefore it inhibits the cell activity. The medications called sedative-hypnotic drugs bind to those GABA receptors, and therefore they increase inhibition of the cells. So the cells, the neuron cells, cannot become as excitable. Barbiturates are one of our sedative hypnotic drugs we're going to talk about. Barbiturates, when used in as high doses, can cause a full depression of the central nervous system. They will increase the stage 2 sleep. So they're increasing that unaware state. They actually decrease the percentage of time in stages 3 and 4, and they decrease rapid eye movement sleep. At lower doses, they bind and they promote some sedation and some sleep, primarily increasing that stage 2 sleep, without depressing the entire central nervous system. If you give a really high dose of a barbiturate, you really end up with the same action as that of a general anesthetic. Some examples of the barbiturate sedatives would be that of phenobarbital, pentobarbital, and secobarbital. Phenobarbital is classified as a long-acting, so it stays in the body a little longer. Pentabarb, a medium-acting, and secobarb is a very short-acting, stays in the system the shortest period of time. Now, barbiturates in general are really well absorbed following oral administration, so we can give them orally, no problem. And once in the circulation, they distribute very quickly throughout the body. You start to see their effects easily within 30 minutes after administration, and that the CNS, that central nervous system depression, within 30 to 60 minutes of oral administration. So they come on and they have their effect pretty quickly, work pretty well as causing a sedative effect in the body. Now, along with them, though, come some adverse effects. Adverse effects of the barbiturates include drowsiness, dry mouth, lethargy, and incoordination, inability to coordinate. You have to remember when we talked about our variations, elderly patients are really sensitive to the CNS side effects, and you may even see in them some mental confusion and some memory difficulties with these type of medications. The one thing that we need to be aware of when using barbiturates is that excessive use can result in tolerance and physical dependence. You can also see a cross-tolerance with other CNS depressants, such as alcohol. So even someone who is taking a barbiturate may end up also becoming tolerant to alcohol. The one concern, one of the things we have an issue with barbiturates is overdose. Overdose will depress the heart, it'll depress the brain, and large overdoses depress all brain activity, and that would include where the medulla oblongata is, which ends up affecting the vital signs, causing hypotension, causing shock, and even death. And unfortunately, with barbiturates, there is no antidote for overdose. So basically, if someone takes an overdose of one of these, we need to get them on life support to support their functions until their body clears and excretes the medication. And if we don't get to them soon enough, brain death will occur. The next group in this are the benzodiazepines. Now, the benzodiazepines, similar to the barbiturates, inhibit the activity of GABA, but they are used primarily in the treatment of anxiety. So they are commonly referred to, more so than sedative hypnotics, they are referred to as anti-anxiety drugs, although they do fall under the sedative hypnotic because of their mechanism of action. So they produce the same effects, similar effects to the barbiturates, because they inhibit the GABA receptors and subsequently cause sedation. Now, the one thing about benzodiazepines is they are lipid soluble, and so they very quickly get into the central nervous system, and they are, again, just like barbiturates, well absorbed after oral administration. So they can very easily be taken orally and distributed quickly throughout the body. Couple of examples of the benzodiazepines. Flumazenil, which may be known as Dalmane, is classified as a long-acting benzodiazepine. Temazepam, you might know as Restoril, is kind of an intermediate acting, and triazolam, which is also called Halcyon, is a very short-acting anti-anxiety medication. The nice thing about these is, again, similar to the barbiturates, they act only in stage 2. They increase stage 2 sleep, and they really don't mess with stage 1. And stage 4, they shorten a little bit. They don't generally interfere at all with REM sleep, and so they produce less tolerance than the barbiturates, and they can be used a little longer length of time. So because people don't become as tolerant to them, their therapeutic effect will go on a little longer. So these can last several weeks where they're still getting the therapeutic effect out of them, more so than the barbiturates, if they're taken on a nightly basis to assist with sleep. Now, as with all our medications, the benzodiazepines do have some adverse effect. Benzodiazepines, for one, similar to barbiturates, can potentiate the actions of other central nervous system depressant drugs. So again, if we're talking about alcohol, we're talking about barbiturates, if taken in conjunction with them, they would greatly potentiate them, and you would see serious central nervous system depressant effects, serious effects on the brain, possibly respiratory system, and vital functions. So really, one which should never be taking these in combination with other CNS depressants unless they're very closely, specifically prescribed and monitored by a physician. The other thing that we have with benzodiazepines that we don't have with the barbiturates is the fact that there is a reversal agent for the benzodiazepines, and that is Flumazenil. And Flumazenil is given intravenously. So if someone does take an overdose or too much of a benzodiazepine, we do have a reversal agent for it. So in this group of medications, we've talked about the two different specific medications classified as sedatives and hypnotics, used to assist with sleep, and in the case of benzodiazepines, also used to reduce anxiety. Barbiturates we rarely prescribe much anymore because of their addictive effects, their quick to tolerance, and their potentials for overdose without a reversal agent. But our benzodiazepines are still pretty readily used, particularly in the case of treating anti-anxiety.